I'm pleased to speak to this motion. The AHPPC, or the Australian Health Protection Principal Committee, is an eminent body of significant health professionals whose health advice has strongly backed in and recommended that there is a mandate for vaccinating all workers in healthcare settings, those who are caring for the vulnerable, be they aged, be they in hospitals, be they in disability facilities. And I back that advice. It not only makes sense, it is about the health advice that's publicly available. Now, I use my personal freedom to seek to protect those who are vulnerable. I'm not a health professional, but I've chosen to get vaccinated back in May, as soon as it was available for my age bracket, which incidentally was the same time that the Premier was entitled to get that vaccination. As the Premier had said, she didn't want to jump the queue, as that she could have got it earlier, but she didn't want to jump the queue. But the queue for my age bracket, which is the same bracket as the Premier, was in May. And I got that as soon as I could. I got my flu shot a month earlier than that, and got my AstraZeneca shot in May. I'm so grateful to the scientists who have made this possible. But why are we saying it should be mandated for those who are healthcare professionals? Some would say, isn't that taking away their personal freedoms? And I have had people raise this with me, and I've said to them, you do realise that the elderly, the sick, the infirm, when they're in aged care facilities, when they're in hospitals or disability facilities, they don't get a choice as to who cares for them. They don't get that choice. They need to know that those who are caring for them are able to best protect them, and vaccination does help do that. Does it prevent all transmissions? No. But it does reduce the level of transmission of COVID. Does it ensure that your health professions are more likely to be able to perform their duties by not getting severely sick themselves? Yes, vaccinations, and the science shows that it reduces the likelihood of people being hospitalised. My 92-year-old mother is one of my reasons I got vaccinated, but as I said, I also got vaccinated for the care of my community. But with our health professionals, we need them to be there to care for the vulnerable. We need to ensure that our health system is best able to perform, because if we don't have more people vaccinated, it can be overwhelmed, and even if you don't have COVID, you may not get an ICU bed if that's the case. That's why I backed this motion. That's why we always have, and I don't appreciate being burbled by the Labor Party.
Members' time has expired.